I'm Scott Wyatt. I am a dentist here in the Piedmont, Surrey area. We've been in practice here for 32 years, started in 1988. Originally, my wife was a school teacher out in Piedmont, and so this was the best place for me because at least I had some contacts, and we bought a practice here in the Piedmont area. 32 years and haven't looked back. You know, whenever I first started out, the office that we had was pretty small, and we really couldn't have a lot of patients sitting in our waiting room. And over the years, that's kind of evolved to where if you go to a doctor's office, many times your appointment's at 1 o'clock, and it may be 45 minutes before you ever are seen by the doctor. And that just kind of sticks in me a little bit, in that my time is no more or no less important than my patients. And so one of the things that we like to do here is we make sure that they know that they're just as important and their time is just as important as ours, and we don't make them wait. Not every person has the same amount of money that they can afford to spend on their teeth, and so we try to, as best we can, conform our dentistry to each individual person and their needs. More than anything else, when a person comes to the dental office, we don't want them to be scared, which is a universally big problem in dentistry. I mean, it's not the most fun place to come. We don't want them to feel pressured in any way. What we do is we listen to them, we look at their mouths, we identify any problems that we might see, and we offer a solution to them. But we do not try to coerce or sell anything to them to try to make them do that treatment. Lots of times I'll have a patient, you know, and they're leaned back in the chair, and you know, if you're sitting there and you're looking down on them and you're telling them all these things that they need to have done, you know, it can be a little bit intimidating. And so when a person walks in here, I don't want them to ever feel like that we are trying to pressure them into doing something. Dentistry is a business just like any other business, except for it's each individual's personal body. And yes, we want to be in the business of providing a living for us and all the people who work here, but we don't want to do that by selling it. We want to do that by just providing a service for the things that people want and need. So the goal is if a new person comes in here, we want them to feel comfortable, that they can entrust their care to us. Hardly any of them call me by Dr. Wyatt. I don't want them to feel threatened, you know, this white coat dude. I mean, big enough as it is. It's kind of like I ought to scare them to death, and you turn the drill on, so most folks kind of figure out real fast that we're pretty laid back around here. Every person that walks in this door is an incredibly special person because they've entrusted me to take care of their dental needs. And it's a little bit hectic, and it's a little bit nerve-wracking to have to do that. We treat people just like we would want to be treated if we were going to a dentist.